Hello and welcome to Insight. I'm Elizabeth Omori. Today I will be flying solo because duty calls for my co-presenter Namdi Odipo. Two critical issues are before us on this edition. We will begin with an issue of global interest: safe motherhood. This is to certify that women experience safe and healthy pregnancies, childbirths, and the postpartum period, and by extension promote health and well-being of newborns. This covers a series of health services from family planning to antenatal care, safe delivery, and postnatal care, all to reduce maternal mortality. A report on maternal mortality by the World Health Organization indicates that the global maternal mortality rate in 2023 was 197 per 100,000 live births. Achieving a global maternal mortality rate below 70 by the year 2030 will require an annual rate of reduction of almost 15%. Reducing the prevalence of deaths occurring from pregnancy to delivery is a concern on the program this week. Easter is one of the holidays or feast of Christianity. It marks the resurrection of Jesus 3 days after his death by crucifixion. For many Christians, Easter is the joyful end to the Lenten season of fasting and penitence. Now, it's the Holy Week. What lessons have been learned, and how do we leverage lessons of the season to drive spiritual upliftment and promote national values for peace and unity? We will also be looking at the importance of spiritual rejuvenation. Once again, welcome to Insights.
Whatever the issues are,
the National Assembly is constitutionally empowered to scrutinize,
however complex or intricate.
We have involved all the academia, the members of the academia. We have involved the academies.
Be it government policies or in fact any issue of public concern.
Our job is to help you gain clarity and make sense of it all.
This is not really healthy for our democracy.
There's a lot of aggrievance in terms of who has been in power longest and who becomes the governor of the state.
It's also in the quality of food being consumed.
After all, perception is insight.
And gaining understanding is also getting insight.
Safe motherhood refers to the care and support provided to women during pregnancy, childbirth, and the postpartum period to ensure their health and well-being, as well as that of their babies. A focus on this segment is on care for pregnant women and their newborns. And Dr. Durumola Kende, an obstetrician and gynecologist with the National Hospital Abuja, will speak to us. Dr. Durumola, thank you so much for joining us on Insights.
Thank you so much for having me for this segment.
Thank you very much. Now, at what point is a pregnancy considered life-threatening?
Thank you so much. The issue of safe motherhood is a big issue, not only for our dear country. The entire world is actually taking it as a serious issue, and it actually assesses a critical review of health of the people. And pregnancy is not a disease. It should be a joyful period and experience that every woman should have and every family should have. However, pregnancy can become life-threatening at any stage. And pregnancy has been classified into 3 distinct segments. We have the first trimester, which is the first 3 months, the second trimester, the second 3 months, and the last 3 months, which is the third trimester. And at any point of these stages, even following delivery, it could also become life-threatening. So there's no stage at which this seemingly physiological process, normal process, cannot become life-threatening. Just to be able to identify them early and institute appropriate intervention. That is the most important thing, because none of the stages is immune against becoming life-threatening condition.
Okay. Now, talking about threats in pregnancy, what could be responsible?
There are a lot of conditions that could be harmful to pregnancy. Okay. Threats could occur either from the baby or from the mother or from environmental issues. Okay. The threats can be in form of medical condition, could be as a result of negligence, and this threat could be in form of pregnancy not be in the right location.
Okay.
That is why it is encouraged, advisable that as soon as a woman misses a period, it should seek medical opinion. Pregnancy tests can easily be done these days. Even within the home, pregnancy tests can be done. And if this is done and it's confirmed that there's pregnancy, and once this is done, it's expected that a pregnant woman, such a pregnant woman, should seek medical opinion. And more importantly, what we call obstetric scan should be done to locate where the pregnancy is at that particular point in time. Because any pregnancy outside the womb is actually a life-threatening condition that can take both the life of the baby. Of course, babies will not survive it, can also take the life of the mother. So the position of the pregnancy, as early as possible, being identified, could salvage or should save such individual from the threat that will occur as a result of pregnancy not being in the right location. Also, another threat that will occur in the course of the pregnancy is for what we call placenta not to be in the right. This definitely the placenta is in the womb, but it is possible that can be in some different part of the womb, particularly in the lower part, which can result in recurrent bleeding for such a woman. And with this, it is an issue that can cause life-threatening events. Beyond just bleeding, it can even lead to death of such a woman if appropriate intervention is not instituted. And a lot of medical conditions also in pregnancy. Pregnancy has been known to be associated with conditions like hypertension, like diabetes, and when these conditions come up, and if it is not well identified on time and appropriate intervention is instituted, it can lead to a catastrophe for the family. So all these are conditions that can become threat to the pregnancy, to the individual. In labor as similarly as supposed to be a natural process, it can also become life-threatening. It can become a threat such a way that when labors get to prolong, when the individual did not seek appropriate medical care in the course of labor, when there's no skilled birth attendant to manage such labor, it can also result into what we call prolonged labor. And prolonged labor can result into maternal exhaustion and can lead to death. So these are the issues that must be of concern. And even at the point of delivery, baby can be delivered and placenta retained inside. And retaining your placenta can also be another life-threatening condition. The woman will start bleeding, and with what we call postpartum bleeding, it can lead to death. And in fact, it's the commonest cause of maternal death worldwide. And in our environment, it has been a very big, significant contribution to maternal death. So life-threatening threats in pregnancy can occur at any point in time, and these factors must be identified early so that appropriate intervention can be instituted and be able to get a better outcome from such experience.
Okay, now let me draw your attention to the issue of miscarriage. Some women face this issue, some taking twice a year in 5 years, let's say 3 times, but they keep having miscarriages. What could be responsible?
Yes, miscarriage as a condition that, of course, negative one in pregnancy, is something that could occur as a result of several factors. It could be as a result of factor from even the conception of the baby. It could be as a result of the formation of the baby. It could be as a result of the location of the baby, because of infection in the mother. It could be as a result of some conditions, we call them immunological conditions, that are in the mother. So there are a lot of factors that could be responsible. Even the womb itself can be for miscarriage. So we know that miscarriage is actually a very painful period experience for every woman, and a lot of conditions can actually be salvaged to make sure that a pregnant outcome will be a successful one. And some of these conditions are things that treating the infection in this environment, which is a very important cause, and then ensuring that pregnant women or women who tend to get pregnant start taking their prenatal medication, particularly folic acid, very early. That can be responsible for appropriate formation and of the baby. So these issues and a lot of things, the diet, consumption of alcohol, smoking tobacco, all this can as well contribute to miscarriage. Just to identify the appropriate one or the one that is in such an individual and prevent them accordingly.
Now, that is clear. So, for anyone that is married, that wants to have a child, what is expected of prospective parents?
Despite the fact that we have insufficient number of medical practitioners available, there are a lot of facilities that can still salvage conditions like this. So it's expected that parents, expectant mother, parents should prepare adequately for pregnancy. Pregnancy that can last for 6 months, 7 months, 8 months, 9 months, it's no more a visitor, no more a stranger to the family. It's expected that appropriate preparation should be made towards that. And it is said that the major cause of challenges with maternal mortality in this environment is the issue of addressing the 3 delays. The first delay is about decision making. The couple should be able to have it agreed as to who will take the decision. If there's need for any intervention, if there's any complication that arising, there should be who is taking that decision for that. That should be properly agreed on. And also, the next delay is the issue of how do we transport this person to the appropriate place. They must be able to identify where they want to go. It's not on the day there's a challenge or a complication that the woman or the husband start looking for where they want to go. They must have identified a place where they are registered, and they should be able to offer the appropriate basic emergency obstetric care for such mother. And if such cannot be done in that facility, the facility will know the appropriate place to refer them to, which leads to the 3rd delay. The 3rd delay we should occur at the level of the facility. If at any point in time they are having challenges, they must have prepared for where to move the patient to accordingly. So there's no excuse at this age why anybody who prepare for pregnancy has taken place and have spanned several weeks and months and not ready for expecting complications. So it is said that every woman should be have a birth preparedness and complication readiness. So there must be preparation for, in case there's any complication, there must be preparation towards salvaging such situation. And also, there's also expectation from the government and from the society, whereby care of pregnant women should also be subsidized as much as possible, so that those who cannot afford this will be able to, with their little resources, be able to afford care at minimum cost that they can afford.
Okay, I will still talk about government's response to pregnancy complications, but let me bring it down to our villages. Some persons would say, due to certain factors, they don't go for antenatal in their families. Some would say, no, they prefer to be handled by the local midwife in the village there. But with such decisions, how do we reduce the prevalence of maternal mortality? Because really, like you said, Nigeria is trying to reduce the number of deaths occurring from pregnancies.
A lot of intervention actually is being instituted so as to reduce maternal mortality. Know fully well that Nigeria as a country, just about 2% of the world population, we are having 10% of burden of maternal mortality across the world. So, which is not acceptable. And we are very much aware of effort being put in place, including the recent pronouncement by the government that cesarean section should be made free across designated hospitals across the country. These are the things that are being put in place. However, we know that people should be the first to take decision. If an individual did not go to the hospital, how will they benefit from free maternal care? How will they benefit from free cesarean section if there's need for it? So the belief that probably religion houses, the use of what we call traditional birth attendant, gone are those days. And we know very well that this still constitutes majority of delivery in our country. And at this age, we should be moving towards a level whereby everybody must have been well educated enough to know the role of specialist care, role of those who have knowledge about complications and threats in pregnancy, knowing what we call skilled birth attendants. Skilled birth attendants are those who are able to manage, identify complications, and refer accordingly. So such individuals should be the least that any pregnant woman should approach for their pregnancy, labor, and their delivery, such that they can still identify this thing, approach, and refer them appropriately. The use of some religion houses, some traditional method or way of delivery at this stage is no more encouraged, because this has contributed significantly to the number of maternal mortality that we've recorded across our country. And it is high time that we start educating our women and let them seek care appropriately.
Okay, let's talk about hygiene for women who went under the knife to have their babies, C-sections. What should be the hygiene practices?
Yes, hygiene is one of the do's that must be well taken care of in the course of pregnancy. Knowing fully well that a lot of things could go wrong, particularly when it comes to infection. Infection could lead to conditions that can, even as easy as being called food poisoning. If there's no good hygiene in form of food that we eat, and all this can contribute to what we call preterm labor, and preterm labor can contribute to preterm delivery. And we know fully well that this is a very important cause of death of the babies when they are delivered preterm. And it is essential that we ensure good hygiene is maintained whenever there's pregnancy. And this is one of the reasons why our women are encouraged to have what we call tetanus tozoid injection. That is the jab. They need to get 2 jabs in every pregnancy, especially for those who have not completed the 5 doses that can save them for life. So for those who have not done this, taking tetanus tozoid will also be of help, especially when baby is delivered in unhygienic environment. It will help to prevent tetanus infection in these babies. But by and large, it's advisable that every pregnant woman should see hygiene as a cardinal thing that must be well maintained. And it's one important thing, do's, that must be instituted whenever there's pregnancy, so that we can have a positive outcome for the pregnancy and also for the mother.
And also for the mother. Now, how do people make informed decisions about their reproductive choices?
The information that people need in making choice about their reproductive life has to do with getting to know that issue of reproduction is a very important fact and very important issue, particularly in our environment. Fertility is a very important issue in our environment. That with this, it is advisable that every woman should plan their life, and also even men as well, so that they'll be able to have a proper decision when it comes to making reproductive decisions. For those who are married, who want to go into family line, it's advisable that a woman should have what we call preconception care. Preconception care is a care offered to a woman who is anticipating and expecting to get pregnant. And one of the cardinal things is the use of what we call folic acid as early as 6 months before the expected pregnancy. This can be instituted, and it's advisable that a lot of risks that are being taken as much as possible when it comes to reproductive decision should be avoided.
Now let's talk postpartum.
Yes, postpartum period is a very important period when it comes to maternal health, and particularly with the issue of motherhood. It's a very cardinal point that can still result in some life-threatening events. So it is a period that appropriate care, monitoring, and intervention must be put in place. And this will include psychological support. It includes in terms of finances. One of the common conditions that can occur following delivery is what we call postpartum blues, postpartum depression. And this is a very important condition that can actually affect not only the mother, even the baby. Some mother can even have some behavior that can make them to start having some harmful behavior towards the child if proper care is not being taken. So a woman that was just giving birth needs a lot of support in terms of what they want to eat, in terms of the psychological support towards reducing maternal mortality and even infant mortality.
Okay, I'm going to be asking you this because when it comes to pregnancy, child delivery, you are very much involved. Now, talking about pregnancy complications, what is the response level like in ensuring that we don't have babies dying and their mothers dying at the hospitals?
Thank you very much for this important question. We all know that National Hospital is in the eye of the country, and it's a center that has been designated as one of the centers that provides what we call emergency obstetric care, and also designated as one of the centers that offer emergency intervention, free intervention within the few hours of patient admission, particularly those, the indigent who are in need of this. And that is why it's also one of the centers that have been designated for women that want to benefit from free cesarean section or emergency cesarean section. So first thing is that, first of our concern is center has been in the forefront of making effort, making input, devising so many methods and appropriate interventions to ensure that maternal mortality is drastically reduced, despite the fact that majority of the delivery takes place outside this big center.
You know, nations are raising to ensure that they meet all the targets of the Sustainable Development Goals. And then our focus is Argo 3, which centers on health and well-being. Now, mothers and babies, do you see us meeting this target before 2030?
Yeah.
Reducing the prevalence of maternal mortality before 2030?
Knowing fully well that the Sustainable Development Goal 3, which is target towards maternal health and more importantly towards maternal mortality. And a lot of significant effort have been put in place. Knowing fully well that 2030 is just few years away. Even the fact that we may not be able to achieve this reduction in maternal mortality towards the target of achieving 70 per 100,000, which is the target. But efforts are being made in place to reduce the current rate in Nigeria as much as possible. And the National Demographic Health Survey of 2024 has shown a little improvement compared to 2018 report. So we are on the track, and hopefully, if we can sustain this and improve on the current effort, we should be able to move beyond where we are. Even at all, we'll not be able to meet up with the target of the Sustainable Development Goal in 2030. And more importantly, is for every pregnant woman to identify the role of prenatal care, the role of medical doctors, nurses, and all other healthcare providers in management of the pregnancy. So I want to encourage that every pregnant woman should have what we call antenatal care. And this starts with approaching the healthcare providers and establish a relationship so whereby the test will be done. If there's anything identified, appropriate care will be done. So prenatal care, antenatal care is the number one cardinal point that if at all you cannot remember anything, this should be remembered. Also, medication that are not prescribed by the appropriate or designated healthcare providers should not be taken in the course of pregnancy. And also, I also want one of the duties to also ensure that a pregnant woman get hydrated. Take a lot of fluid as much as possible, because dehydration will also complicate and become a threat to pregnancy. Another important thing is our hygiene. We should ensure appropriate health care hygiene, ensure neatness. This is very important. Alcohol and smoking should be avoided completely as much as possible in the course of pregnancy, because they can contribute to negative pregnancy outcome. Beyond this, how do we take care of ourselves? How do we take care of our teeth? In fact, it has been found that inappropriate dental care, not taking care of our teeth, our mouth very well, will result in some medical conditions that can end up with complicating pregnancy. All these are the things that we must make sure we observe. And what are the don'ts? It is one of the don'ts is to ensure that no pregnant woman should approach unqualified centers, unregistered centers, to have either their pregnancy care, labor, and delivery in such centers. Everything should be done where we have been registered for appropriate care for pregnant women. Beyond this, also, one of the things that should not be done is to make sure that no pregnant woman involved in exercise that has not been approved by healthcare provider. We encourage that every pregnant woman should be active, but there are some exercises that have been dedicated, assigned, or approved for different stages of the pregnancy. So we should approach our healthcare provider to guide us in the appropriate exercise that are due for each stage of the pregnancy. Also, one of the things that we must also not do in the course of it is to ensure that we avoid what we call unpasteurized food and milk. can cause a lot of infection. Also, raw food should be avoided as much as possible. We shouldn't eat contaminated food, even though the fact that no matter the economy it is, we should ensure that our health is taken very seriously. And it is also encouraged that for a pregnant woman, at the point of giving birth, we should make sure we don't approach where it's not recognized or registered as a place of delivery. We should go to the right place, seek care and seek care for delivery at the appropriate places. And lastly, I also want to say that couples should get prepared. What they should do, get prepared and get ready, prepare for pregnancy, for labor and delivery as if it can happen anytime. Such a way that we must always be birth prepared and complication ready.
Okay, I'm forced to ask you, finally, what about the use of anti-malaria drugs and analgesics for pregnant women? We need to be clear on that.
One of the important recommendations beyond the tetanus toxoid I've made mention about injection is use of malaria prevention prophylaxis. Every month, once in a month, it is recommended that every pregnant woman from 13 weeks, actually from the second trimester, from the second part of the pregnancy, must start taking anti-malaria once in a month. It's a 3 tablets of medication that will be given to every pregnant woman in all designated healthcare facilities where antenatal care are being offered. And this is very important not only for the mother, also to prevent malaria for the baby, which is also one of the causes of sickness or disease in the baby that has just been delivered. So malaria prevention is a very important recommendation, just as we have the prenatal medications, the iron and the folic acid as part of what should be taken regularly to ensure safe motherhood.
Obstetrician and gynecologist Dr. Durumola Kehinde, I want to thank you so much for enlightening us. Very compact and comprehensive. Thank you very much for your time. We do appreciate your presence. Thank you so much.
Thank you so much.